Hi, welcome back to Speak Up Africa. I am delighted for the audience that has been there for the most part of the conversations we've had, and we aim to always bring you impactful conversations. And today, I am here with a gentleman who will speak into matters technological innovation in the healthcare space. I don't know what you have to say about this state of healthcare in our nation today, but technology has improved how we heal and generally how we live. Julius, thank you so much for making time to be with us here at our podcast. Tell my audience, who are you and what do you do?
Really glad. Thank you for the invite. It's taken a long time to make time for this. So thank you for chasing down to have this conversation. It's an important conversation.
Yeah.
So I'm Julius Kabangi. I'm a CTO at Antara Health, and before that, I was a CTO in another health company. So in the last 10 years or so, I've spent most of my time thinking through and building systems around digital healthcare, all the way to enhancing, with attempt to enhance access to quality healthcare and affordable healthcare. Yeah, and it's there's a lot to be said about our healthcare in so many ways. So I'm really looking forward to this conversation.
Great.
Yes.
CTO. Yes. What is CTO?
Well, to the outside, it's often just a title, really. Okay. But what it speaks to is, as a CTO, you're in charge with the strategy, what need to be built, the prioritization of that, and really thinking through the impact of what you are building, whether it's the right thing to be done. Often you become, the face of the company that you're working with, in terms of technology to the outside world.
So it stands for
Chief Technology Officer.
Okay, yes. Fantastic.
Yes.
For here we are mandated to educate and enlighten. So when you say that, it could mean different things at different capacities. So I just wanted you to let us know what that means. Yes. Straight into it. Mm-hmm. So many cases, so many outcries about the healthcare system in our nation.
Yeah.
I've worked in that space. I know how saddening it is. And here we are saying we have technological innovations that can make this space better.
Yes.
How has that been this far?
It's been mind-opening, mind-blowing. Mm-hmm. Especially because in healthcare space, there are just so many problems. Mm-hmm. In healthcare, I mean the healthcare ecosystem in our country. Access remains to be a major issue, for instance. Mm-hmm. Today, our doctor-to-patient ratio stands at 1 doctor to 17,000 doctors, to 17,000 patients, while the recommended ratio is 1 to 1,000. So you can see how far off we are.
Exactly.
Then if you have to think about, the disease burden that our country has, it's really significant. Today, out of all the deaths that are being reported, 39% of those deaths often come from lifestyle diseases. And if you go to any public hospital today, you'll spend endless hours on the queues. Lucky if you have money to go to the private sector, which again as well, to find a doctor is also, really hard in itself. So there's so many complexity of it. And to me, the work I've been doing has been just a scratch on the surface. And I think there is a lot we can do collectively as a nation, collectively as citizens, in conjunction with the government and everyone involved, because a healthy nation, a wealthy nation. So it's really important in that sense.
Ideally, these systems should help us get better services and better access.
Yeah.
It's been a decade of you working tirelessly with the team that you have and the companies that have come together.
Yes.
How much adaptation has the Kenyan healthcare system absorbed to making and enhancing the healthcare system?
Well, I will look at it not mostly from the work we've been doing, but generally I will take that question from the angle of general adoption of technology within the healthcare space. And I would say it's still way, way, way behind. Surprisingly, it's just not Kenya, everywhere. The healthcare adaptation of technology is really, really, really wanting in so many ways. I think in the last 3 years or so, it's when you go to the hospital, you find desktops, and doctors, you see them type in for the first time. Before then, they used to just write on papers and whatnot. And mostly this is, I think, just true for private healthcare facilities.
Yes.
In most public, it's still the paper-based, way manual
That's true.
process. So we are still far behind, which then means that, and there are reasons for that, and there are so many of them. First thing is healthcare has so many stakeholders involved. If you take an example of yourself going to the hospital, the amount of people you have to see before you come out of that hospital setting, there are just too many already.
Yeah.
And from a technology angle, it means that if you're building solutions around healthcare, you have to cater for all of them.
Yeah.
So it becomes really, really, really a lot of work to get it done. Which then means, in my past work, one of the obvious thing that has come up is that if you're building solutions around healthcare space, you have to build it together with the users from day zero, not after. Yeah, so that has been one of the key underlying understanding. Yeah.
Julius, it's interesting that you mentioned how you walk in, there are so many people that you have to interact with before you walk out with a diagnosis.
Yes.
Then if we are bringing technological solutions, that means your data is being keyed into technological devices. How safe is the data that the patients share or input in these softwares or platforms?
I think it's, when it comes to generally digital technologies, data safety and data security is something that often is a preserve of the builders of the tools. So if you are using systems that have been built by credible people, often the security will come baked in. But beyond the security of it, there is, of course, the bounding rules of data confidentiality. And this is an oath that majority of the healthcare professionals have to undertake, so that information is not freely being shared out there. And then looking back, there has been regulations in this space. In, I think, 2019, that's when the government passed in the Data Protection Act,
Yes.
Which, by enacting of that law, it forced most of the companies to think about data privacy, data leakage as one of the things that they have to do before they even start to build. So I would say it's relatively, I think security is there. But from a security angle, I always say that data security starts with yourself, you being conscious of it. Because often when it comes to leakage of information, it starts with the people that this data belong to, not necessarily the system that
the user is always the weakest link.
Exactly. So I would say generally it's safe in that sense, but it's better to be conscious.
Okay.
Yeah.
So what are some of the systems that are being built at Antara that are being deployed in the healthcare system? Somebody could be sitting there and wondering, okay, what is this exactly, and what do we mean about technological innovation in healthcare?
Cool. I think this is where I introduce what Antara does and the system we have built behind it. Okay.
Yeah.
So about 6 years ago or so, myself and other folks came together. And, it was, we had one mission, which is build healthcare system infrastructure that enables people to be taken care of both at the hospital and outside of the hospital. More like, we call it a longitudinal care, access. And longitudinal means that healthcare is not something you do in one instance. It's something you do on daily basis. So we've been building systems that helps you live healthy on daily basis, as opposed to you waiting to be sick then go to the hospital. And I'll take an example of what that kind of system, the journey of that kind of a system for someone who is chronic. And I started by saying that we have a major lifestyle disease burden in the country. And I think it's about 30% of the population are dealing with lifestyle diseases. And these are diseases like hypertension, diabetes, asthma, those kind of diseases. They are diseases that once you get it, chances are you will be managing it for the rest of your life in most cases.
Yeah.
And in Kenya, and maybe in Africa, almost actually across the globe, healthcare has been more of an episodic kind of thing. You only go in when you're sick, when you're feeling itchy. You don't have a system that makes sure that you're consuming care on a daily basis. So a hypertensive person, for instance, using the tooling that we have put together, will get an access to a mobile application, a WhatsApp line, an SMS line, and a call line. More like communication tools that are ubiquitous in nature, meaning they are easily accessible to everyone. And an app to look at your data on a daily basis. So once you get access to this on a daily basis, you have access to nudges of information pertaining to the specific condition that you're dealing with. Right. Then taking it further, there is a team behind the scene, a healthcare profession behind the scene that are making sure that you are doing the right things on a daily basis. Things like, for instance, are you eating well? Are you sleeping well? Because these two factors have a big role to play on how your general wellness. And then at Antara, for instance, we would give you, a blood pressure cuff, for instance. If you're hypertensive, you take measurements and you do that for 2 weeks period. You feed it into an SMS line or the app, and then instantly you get to understand how is your condition improving over time. And also behind the scene, the system we have built again are triggering action items for the healthcare team that we have, the system have assigned you. So there'll be a nutritionist, for instance, that will get to know that this person, their blood pressure has gone high a bit. Is it that they are taking too much salt? Salt is one of the components that need to be regulated when you're hypertensive. And this system will keep triggering this action and prompting this healthcare professional to go and act on your behalf. And then as you're going with your day routine, someone from the team, from this healthcare professional team, will call you to discuss what they're observing and to inform you what you should be doing to reverse the course. And then you find, again, if you're hypertensive, you often take medication in most cases. This medication often need to be reviewed every other 3 months or need to also be refilled on different times. So the system is there to make sure that the person who is supposed to be refilling your medication, refill those medication on time. You don't have to remember that. The team the healthcare team also doesn't have to remember. The system is doing that for them, and it's for them just to take the action. Then it goes all the way to things we call health management plans, where a snapshot of who you are in any given time is taken by the system. Someone within the care team looks at it and devises a life modification things that you need to be doing on a daily basis for you to live a better life. So that's an example of a hypertensive. So we do that then across all the other diseases, especially the ones that are prevailing. So the likes of diabetes, asthma, arthritis, and all those kind of diseases.
I was actually writing down notes when you were speaking, because that's a very fantastic way to deal with the client from the place of diagnosis.
Yes.
All the way to maybe being cured or just being able to manage.
Yes.
But as you were speaking, in my head I was thinking, someone would argue that now with the technological innovation, this locks out people who are illiterate, not tech savvy, not able to access the gadgets and facility. You need data, you need Wi-Fi. How does that make you feel, and how true is that from your point of view?
Well, as I've said, our systems and what we build is technologically ubiquitous. As long as you have a phone, regardless of what type it is, you sit pretty knowing that someone is taking care of you. I'll give you a testimony actually of someone, I think in Nakuru, who was saying, I did not believe that I could receive this amazing care with my katururu. Katururu means
The small
the tiny.
phone.
Because
Yeah.
all it takes, you might not be tech savvy, but there is an assigned care team that is tech savvy.
All right. All right.
And then also we are living in very interesting time where if you make a call, you can easily transcribe what is being said and get, and look at it, the conversation from different angles and really get to understand, is this someone who is going through health issues or mental health issues, all those kind of things, and also helping the person on this other line to really understand the context of the conversation and assimilate all that information to everyone involved in that care.
Okay.
Yeah.
So people should not really shy away from that fact, because I've had different conversations where people are saying, I know technology has come to save us,
Yes.
but where does it leave the majority of people who live probably below the poverty line and are struggling to just meet their day-to-day needs,
Yeah. And healthcare in itself, again, has so many complexity from a technology angle. There is an issue of the ratio, for instance, right, that I spoke about. And technology enhances this ratio not to be a burden to healthcare ecosystem, but rather for this 1 to 17,000 people to be able to effectively go through so many patients than they would have in the past.
Yeah.
So it's an enabler in so many dimensions.
Yeah.
Another dimension of it is information. I like to say that we ourselves are our first doctors before we go to the actual doctor. And the more informed you are, the better someone else is able to take care of yourself. Which means that, if you have a katururu, for instance, if I send you a message, if it's a show and you send them a message, they might give their younger ones, say, please read this for me.
Yeah.
So there are so many, aspects of technology that significantly shifts the type of the care people receive today, in terms of increasing access, affordability, and quality of the same.
Yeah. Let's change gears a bit, Julius.
Yeah.
When you speak, I hear and feel a lot of passion for healthcare, for great service delivery, for help.
Yes.
What drew you to exploring this element of technology? I would want you to fill us in, give us a little bit of window into your life. Was tech always your thing, and then was healthcare always what you wanted to explore and bring a difference and impact in?
Well, yeah, for sure. I have a lot of passion in it, and you're clearly to spot that out. It's for me. It's I'm not sure whether I'm ready to share the entire story of it. But it's personal in some way. It's personal in the sense that I've come from background that has have created environments that feels like accessing healthcare in its brokenness is a preserve for the rich, and it still is the case.
That is true.
And I've lived and seen experiences in my own family tree where we were denied care because of these issues. So my passion is driven from that. My innate feeling that I have access to knowledge and skills that could move a needle in this space. So there's personal stories I could go there, but I'm not ready in this space yet. But that's where the passion comes from. I did not go in it with from the perspective that it's something that I should be doing. It's a call of I feel like it's a purpose or a calling of sort to keep using my skills and knowledge within that space.
Yeah.
So it comes from that angle.
Okay, great. Thanks for at least sharing that, because honestly, for me, I look at people who practice from a place of passion.
Yeah.
For me, that brings fire that does not easily die off, because there are challenges.
A lot.
And let me shift gears to the challenges we've had even in our nation. We're in a season where young people are calling for change,
Yes.
calling for accountability, calling for, for our leaders to be there and be accountable for their actions. And the healthcare system in our nation has been hit very hard. When we had the shift from the different insurance funds for the nation, and we were seeing monies disappear, and nobody wants to stay accountable to that. That could be a hindrance in how much health practitioners will be willing to embrace such technological systems because actually there's a lot of accountability, to it. How do you think that will play, and how much of a hindrance will that be in the innovations that you are having in technology?
I actually don't think it's an hindrance. Because it's the thing. Just looking at the figures in terms of how much the government should be spending within the healthcare space, I think today we spend about 2 shillings per person for the government in terms of investment within the healthcare space. While in other countries, especially the developed one, they spend about 100 shillings per citizen. So in that sense, it means there's a lot of work to be done in healthcare space. The government in the past has always been doing, I think, the hardware fix, which is attempt to fix drugs, attempt to bring machines and all these things, while there are still other fundamental issues to be fixed. For instance, the software, which is more about more doctors and more nurses, more nutritionists, more of these people that do deliver the healthcare. I think that's still a space that is still way behind. And regardless of how much you invest within the hardware, if you're not working on the software, these will be machines that will be left idle within the hospital facilities with no one to use. So the share thing and the shift thing, to me, is actually a really good thing. If properly utilized and if properly deployed, and deployed in a way that it's meant to make the real difference, not it being thought as a way to collect money. If it's purely intentional and with the right meaning, I think it's a really revolution in that sense. And as I've said, in healthcare space, technology is still far out. Government investment in SHA and SHIF doesn't in any way hinder innovations to come out. In fact, it promotes that, because we still are very far. Our healthcare is very fragmented. By fragmented, I mean the amount of, if you look at all the hospitals around, they don't talk to each other. While people live from you work, maybe you live probably in Thika, and then you come to work in town. And when you're in town, that's where probably you go into to seek care. And when you go back home, you still seek care on that end. And these systems are not talking to each other. That's one example. There is also the fragmentation of formularies. Formularies, I mean the medications that are circulating in the industry, which then means that people are receiving. Some people are receiving snippets of quality, and others, majority of the others, are receiving snippets of quantity. There's a lot of complexity all around, and I still think there are so many innovations to be done. When I spoke about us as Antara approaching healthcare delivery in terms of longitudinal access, you can imagine the amount of engineering we have to do on each specific condition. And you can imagine the amount of conditions that exist out there.
Very many.
Very many. So
Julius, wait, there's Allow me to take a minute
Yes.
and really draw your attention to this perspective.
Yeah.
For example, the national insurance that we have now for health,
Yes.
on paper, it's the best.
Yes.
I mean, Julius, if we could execute that, we would be far apart from other African
Yes.
democracies.
Yes.
But the problem is the corruption, the greed that is in between it.
Yeah.
So I'm sitting here with you, and the innovations that you're talking about are mind-blowing.
Yeah.
I mean, who would not want that?
Yes.
So on paper, on development, it is really good.
Yes.
But the question is, will our healthcare professionals adapt to that? Because, Julius, in African nations, what happens is it's in between, from the user and the developer to the cartels in between are who make things worse for us. And so these are good innovations, these are good systems. So let me ask, as we are right now,
Yeah.
and how far you've come, how much of health professionals have adopted to the systems that Antara is coming up with?
So to date, I'll give you the figures. Today we have served about 25,000 lives. And that means these are people on daily basis that are receiving, care on daily basis using our ecosystem, which means you could say we have admitted 25,000 on people we are taking care of on daily basis, right? Behind the scene, we have a pool of doctors, nurses, nutritionists, mental counselors, and then we also have, a referral network that we have built out for people to be referred out to other facilities, to other doctors, specialists, and whatnot. The adoption has actually not been a challenge, like really, because the thing is, systems, as long as you build systems together with the users of the thing, adoption never is an issue. Because often in life, you often have to balance interests. What's the interest of me using this system? What's the interest of me not using the system? So it's about the engineers, the developers, the people tasked with that want to build this system to work together with the people, the would-be users.
Yeah.
So if you build them with the would-be users, adoption is not a problem.
Okay.
Because again, a lot of problems, a lot of pain going around in healthcare space, which then means anything that comes in that solves a problem that is being felt across the board, people will take it up.
Yeah.
Yeah.
This is great because it now sheds a different light that with the systems that are being developed, you don't necessarily have to walk into a health institution for you to access.
Yes.
So what are the responsibilities and the roles, let me call them that, for lack of a better word, for patients who want to now consume the systems that you've come up with?
The roles. I think it's a trust. It starts with the trust. Often that's where the biggest issue is often the trust, especially on the I like to call them members, not patients, on the member of the ecosystem. First, trusting that there is true intention in this thing and giving it a chance to see what it will do for you. So the first role is that more than anything else. And then the other thing is being a participant in terms of feedback back to the ecosystem with the need to improve it.
Yeah.
Because often you find that, especially in Kenya, there's a lot of culture where people just go silent without giving feedback on what went wrong. Yeah. So I think those are two primary roles that I think are the most important ones, where give trust and feedback for the improvement to keep going.
Yeah.
Yeah.
Why I'm laughing is most of the times when I honestly am a victim. Sometimes you're with customer care and a service has been offered, and then they say at the end of the call, please give us a few seconds to give feedback. I'm always like, I don't think I have that time.
Yes.
But when on the flip side of it, when the system has a problem, I would be the first one to complain.
Yes.
On a light note. So, Julius, you're moving into a generation where people are born with technology.
Yes. Yes.
Technology is part of them.
Yes.
I was having a conversation with another friend, and we said, I think the millennials and the Gen Zs, technology was born into them.
Yes.
Some of them are born and then they adopted into technology. But I think some fraction of Gen Zs and then Gen Alphas and the ones who will come, they are being born right into technology.
Yes.
And to whom much is given, much is expected.
Yes.
So consumption is up.
Yes.
And there's something you said at the beginning of our conversation, that we have this culture where until you're so sick,
Yes.
that's when you go seeking
Yes.
help,
Yes. Yes.
I want you to talk into that category of people.
Yeah.
Myself being included. How can we use technology to make ourselves better, in terms of healthcare and just general well-being?
Yeah, that's a very tricky one and tough one in so many ways. Because you're right, Riso, to say that the generation that one has been it's upcoming. It's extremely informed, not necessarily tech savvy. The information is in their fingerprints.
Yeah.
And especially the young ones, like the alphas, they are reading things on a daily basis. As to whether what they are reading is factual, it's a different conversation altogether, right? But then in terms of, I would actually say not using technology to make, for healthcare, for their healthcare needs. I would actually think of it into two angles. I think one is using technology to promote healthcare for others. Meaning, we now live in a generation where access to information is really, there. But curated, important, useful information is not there. Right?
Yeah.
And this generation, the one call to action would be, as you're consuming, think through, can you curate it and share it out? Because that's the first thing, where you get informed, and if you're informed, it's easier for you to give services, to receive healthcare for yourself. Then, for instance, at Antara, what we do is we build tools that ensures that in case you have any question, anytime, anywhere, you can always ask a health professional, and they are always available to respond to you on that. Because I know for a fact, majority of people don't want to waste 5 hours in a facility seeking care. Majority of us don't want to do that.
True.
And the reason,
it's hectic, to say the least.
Yes. The reason why they don't consume is purely because it's not convenient anymore. Which means then, as you're becoming more tech savvy, I think it's important for us to also give a chance to the digital health access ecosystem, the likes of telemedicine, the virtual primary healthcare providers like ourselves, for you to serve those needs as opposed to you ignoring and then it becoming a major issue downstream. Yeah. So those are the two roles I'll speak out to.
Yeah.
Build as you access.
Yeah. So,
yes.
You see, there's power in technology.
Yes.
And there's an analogy I have.
Yeah.
There is knowing something
Yes.
that can lead you to doing something.
Yes.
But in between there's becoming,
Yes.
And I like what you've said. This generation, you could have access to information, but how accurate is that information? And then what do you actually do with that information?
Yes.
So the gap and the biggest task is in between here, becoming, You've had this thing of Google will always tell you what you want to hear.
Yes.
You actually ask Dr. Google,
Yes.
and
Terrible idea.
it
Terrible idea.
it will give you the diagnosis, number one, you are fearing, and the sicknesses that, blah,
Yes.
blah, blah. And
Yes.
all that is technology, Julius.
Yeah.
So how do we, as a back-end developer, how do we help people to sieve, information that... this could be useful. This could be harmful.
I think, especially in the context of health,
Yes.
I think the right way to use technology for you to access care is actually to inform yourself on the right type, the kind of question you should ask the healthcare professional that once you meet them, not to take action from the information you receive. That's my perspective. That use it to understand what might be going on and to formulate questions. And then once you have that ready, now go seek care from the right people, from the professionals.
Yeah.
And you can run through them the questions that you have. Sometimes I tend to think that doctors often lead to a diagnosis based on the questions you ask, the question they ask you, and the answer you give them. You might forget just one critical detail, and that could be what saves your life. Or you might not ask one single question, and that might be what saves your life. So I think it's consume technology to aggregate and to cumulate. I don't know the word to use there, to get the right question to ask and inform yourself, but then make sure you seek value. You seek clarity from the right person.
It's like AI. Whatever you feed it in, it's exactly what it gives back out.
Yes.
Julius, Antara is doing fantastic jobs with the system developments.
Yeah.
What's the future of tech in healthcare from where you see it and what you're working at?
One of the things I'm very, very excited more than ever is the AI space and the impact of AI space in healthcare. And I see majority of stakeholders in the industry, in the healthcare industry, and stakeholders I'm talking about insurance, health professionals, engineers like ourselves, all of them know for a fact digital health is the way to go. All of them accept that fact. But how to get there is the biggest question mark. And I see a world where what we are doing will become the norm in the next probably 10 years or so. And it will even be more accelerated with now the advent of AI in that space. So there'll be better, I would expect to see better diagnosis and fast of diagnosis, optimization of X-rays where you're not waiting forever to get your results and whatnot. Better tooling in terms of decision support tools for the doctors and nurses and whatnot. Looking forward to see a very informed generation from a healthcare space, because again, health education for ourselves is really, really important. It's what helps the healthcare professional take care of us in a better way. So I see a very exciting future within the healthcare space, and so many interesting tools, systems, and innovations coming out of it. Yeah.
Interesting, Julius, you mentioned AI.
Yes.
AI has become the new you and I.
Yeah.
And they are it's alleged that 85% of African democracies are yet to even interact with AI.
Yes.
And what that is all about.
Yes.
And yet that is our future.
Yes.
And most professionals are feeling threatened by the coming of AI.
Yes.
But the reality is we cannot run away from it.
Yes.
So in healthcare, how do we, because people say in the next couple of years, we won't need doctors, we won't need nurses, we won't need, because AI will be able to give us a holistic solution in that space. How true is that?
Well, my thoughts is that we'll never get rid of doctors, nurses, and whatever. I don't think we'll ever get rid of those. Because unless... I actually don't think we'll ever get rid of them, because when I think about what healthcare service is, I think of it as it's a lot of trust. It's a lot of trust that if I speak to this person, I'm going to get healed, even before you get the diagnosis and whatnot. I think there's a lot of that element, and human touch is really, really crucial in healthcare space. In other spaces, it might not be said so, but in healthcare, it will be that. But then in Kenya and Africa in general, I gave you the figures of the ratios. It's going to really massively support access to care and affordability and quality
Yeah.
in equal measure. So, and it doesn't mean that people, will be rendered jobless.
Yeah.
It will just, especially in healthcare. The other spaces we can debate about that, but from a healthcare space perspective, I think it's actually going to make it way, way, way better. And I'm saying this because my experience and my perception of healthcare innovation is that I think healthcare is about 20 or 30 years behind in terms of innovation within the healthcare space.
We have a lot of catch-up to
worldwide,
do.
actually. It's not in Kenya, worldwide.
Wow.
Yes. So, there is a lot of catch-up to be done. And there's a lot of layers to be, there's a lot of fragmentations to be broken apart for it to be streamlined. So to me, AI in healthcare is actually a blessing.
So we should embrace it.
We should embrace it. For the others, it cannot be said.
Yeah.
Right? But I'm not sure whether I answered all the aspect of your question. I think I focus a lot on the healthcare.
It actually makes sense because I think right now, with the little information and interest that African democracies have, the conversation is more around, should we embrace, should we not? Has it come to replace, has it not?
Well, this is the thing. We don't have a choice. In terms of embracing AI, it's not a choice we have. It's here. It will happen whether we like it or not. And it will happen because there are so many aspects of our infrastructure that we don't control in Africa. For instance, we don't control the phones, the type of phone we use. We don't control the type of computers we use. We don't control those. So, which then means that the change will be forced on us either way. So we have to.
Because you could actually argue that, oh no, I'm anti-AI, but the device that comes to you has actually the features put in it. All right, I had never thought about that, Julius.
So we don't control infrastructure. So a lot of our infrastructure, which means, and then this is a thing, and this is also my personal thought. AI accelerates capitalism by far, right? And in itself, it means folks that are looking forward to making money, they embrace it because, according to them, it helps them make more money.
That's
and
true.
Save money, make money. As long as it's doing those two things, people are going to adopt it. And the way to emanate is more of, if it's a business like this, if you are struggling to make your maths, all you do, figure out how to use AI, get rid of one expense. And as a result, then you become more profitable. That's capitalism for you. And capitalism has been the way of life for us
for the longest.
For the longest.
Actually, for our lives.
For our lives, exactly.
Yeah.
And because it accelerates that, then we don't have a choice. We'll just have to do it.
Let me ask you, top of the mind. I'm also very passionate about how our leadership and governance is done in this country. Do you think our leaders could intentionally delay our exposure to technological innovations? Because, a man who is powerful, you get to the table to negotiate with them. You cannot exploit them, I've had numerous conversations where I've said, Julius, I think the state in which we are right now has deliberately been placed on us because somebody somewhere says, if I empower Julius, then how can I rip him off? How can I exploit him? So do you think they can delay the technological advancement deliberately?
No.
To deny us?
No, they can't. They can't. They don't even have the means of doing that. Because then again, on one hand, it works against them. The companies that controls the infrastructure I'm talking about are more powerful than, in most cases, our governments by far. Right? We, as humans, the society has come so far along that we cannot survive without these devices. Right?
Yeah.
Even the governance cannot be done without them. which then means, there is no way to turn it off. Because turning it off means stop the means of production. And the means of production is what you need for governance to work.
So actually, it's a double-edged sword.
Yes,
so there's no way the latter will work if the former has not been implemented.
Yes.
Interesting. Interesting. Julius is somebody who's listened to us in this conversation, and they're like, that's pretty interesting. I have a mom, I have a child, I have a colleague, I have a friend who I would want to hook them up with these systems to ease up some burden that is there.
Yes.
So how do we get in touch? How do we get to these systems?
These systems. Well, and here you're talking about Antara ecosystem, for instance. Today we've been working mostly with the insurance companies. We have not yet opened up to the wider public that are not insured for a reason.
Okay.
I can speak to why. So if you're insured by the big insurance companies out there, they're like almost all. It's easily, you can go on our website, download the app. If not that, you can easily just call our toll-free number line and you'll be able to access the service. Yeah.
I will be sure to...
Or even WhatsApp, and you get requested to register and move through all the way to the end.
All right.
Yeah.
So do you want to say the toll-free number? We just caption it.
We'll caption it.
Okay, so I'll definitely be sure to caption the toll-free number and the website and how people can get access to you. This conversation can keep going on and on. And I promise you, this has just been a tip of the iceberg. I would want you to give us your parting shots, and we hope that you will be back here when more innovation is being done and when we have more solutions, so that we can keep having these impactful conversations.
Thank you.
But for now, I would want your parting shot as we come to the tail end of the conversation.
Wow. Thank you so much for hosting me. This has been very great. I enjoyed the conversation a lot. To the audience, be a believer. The world is your oyster. Make something out of it. It's on you. That's it. Thank you.
Julius, I truly appreciate, at the beginning, we just said how this has been a chase to just being able to, both of us have time to sit here. So it's an absolute honor to sit in your presence. And we are grateful and proud for some of the works that you're doing to make our society and our nation at large a better place, and the country and the world, We wish you all the best as you continue in that endeavor. Thank you so much for listening in today. Your healthcare primarily starts with your response. You're the first person to take responsibility over that. And we've had different conversations, points of conversations today on how you can make that better. We will wait for the systems to work, but we can actually decide to individually and intentionally take up the mantle. I have been your host today, Wendy Lois. I am looking forward to having you in our next episode, where we will have more great, impactful, and educative conversations. I will love and leave you for now up to the next time we see you. Kwaheri.